Puerto Rico Medical Board style clinical vignette. Topic: lymphatics in the neck affected by a lesion reaching the mastoid process. Clinical vignette. A 30-year-old male presents with a swelling in the left side of his neck near the mastoid process. Upon physical examination, there is palpable lymphadenopathy along the posterior cervical chain and tenderness in the region of the mastoid. The patient reports a recent ear infection, and a CT scan reveals a lesion affecting the mastoid process. Question: which lymphatic group is most likely to be affected by a lesion in the mastoid process? A. Superficial cervical lymph nodes. B. Deep cervical lymph nodes. C. Posterior auricular lymph nodes. D. Submandibular lymph nodes. Correct answer C. Posterior auricular lymph nodes. Explanation: the lymphatic drainage of the head and neck is organized into several nodal regions, with each region draining specific areas of the head. The mastoid process is located near the posterior auricular area, which is drained by the posterior auricular lymph nodes, also called the mastoid nodes. Key anatomy notes. The posterior auricular lymph nodes drain lymph from the external ear, scalp behind the ear, and mastoid region. The superficial cervical lymph nodes typically drain the skin and superficial structures of the neck. The deep cervical lymph nodes drain deeper structures like the pharynx, larynx, and thyroid gland. The submandibular lymph nodes primarily drain the mouth, nasopharynx, and lips. Clinical considerations. Infections, such as otitis media or mastoiditis, can lead to posterior auricular lymphadenopathy. A lesion in the mastoid process often causes swelling and tenderness in the region, and the corresponding lymph nodes will enlarge as they filter bacteria or viral particles from the affected area.